So thank you so much, Carolyn, for participating in this video discussion after Jan's talk. And it's all yours.
My name is Carolyn Ediger, and I want to thank you for the opportunity to tell my story. I am a constituent of Jan Schakowsky's and have been a very strong supporter of her and so proud of what she's done on behalf of senior citizens for Social Security, Medicare, and now for introducing bills and signing on to bills for Medicare for all. My story is a little bit different in that it is about my children at this point. I had 4 children, 2 of them, and all of them have college education and have graduated. 2 of them are currently working part-time jobs because they made the terrible mistake of aging and they're in their middle and late 50s. So their student loans are all paid off and they're good in that respect. However, the part-time jobs they have does not cover healthcare insurance. Thank God for the Affordable Care Act, for President Obama and Nancy Pelosi's efforts to get that for us. That's the only thing they have going for them. However, this discrimination, this age discrimination that is going on with people that are in their 50s, perhaps even 40s, but I know because my children are, like I said, in their middle and late 50s, and they cannot get full-time jobs. And they've got a college education. They had very good jobs in publishing and that kind of thing, but that market has totally changed. And even with the experience that they've had, it's the age thing that always stops any chance of getting a full-time job. My daughter is living with me currently because she can't afford housing. So we need to address the issue of affordable housing. That's a big issue. And what's happening in the cities right now, it isn't only San Francisco, it's Chicago and New York. We need affordable housing in these cities for our people and opportunities, job opportunities. And this discrimination, age discrimination, is alive and well. And I don't know how we're going to stop that, but we need to make the effort. Thank you for letting me have this opportunity.
So Carolyn, you say your children can't get full-time jobs. That means they don't have insurance. That's not a benefit, is that right?
That's right.
And so that's the real issue.
Oh, that is another real issue. And even the full-time jobs that they looked at were paying less than $15 an hour, plus there were no benefits. So they have settled for the part-time jobs so that they don't get that many hours or monetary benefit that makes them ineligible for the Affordable Care Act. So they're in a bind. They're between the rock and the hard place, so to say. And we must address that, and that's why Medicare for All is so important. And as Representative Schakowsky said, it's going to cover our health care for all of us, children to senior citizens. Everybody will be covered. But it also includes dental, which is so important. Without dental care, I mean, that's one thing that contributes to heart disease and strokes. We need vision care, and that is not only for senior citizens, it's for children. I mean, if they can't see, the blackboard and see well enough to read, they're not going to make any gains. Hearing is another one, and that again, under the health care bill, it will cover that. Hearing for children as well as senior citizens, and all of those in between. And then, of course, there's the mental health issue. And that is another one that is going to be covered. And I know that Jan Schakowsky, I believe Danny Davis, and Dick Durbin, and I believe Senator Duckworth have signed on. And it's a bill for children and adults who have suffered from violence in their communities and the post-traumatic stress syndrome. And that will assist them because that is a lifelong ailment that they are fighting to get over. And that also puts these people at risk for finding full-time jobs. They can be overwhelmed, and then it's a reason for an employer to let them go. They have special needs, and they should be treated as those with special needs. And there are the employment agency or the company that hires them can make those accommodations. The government says they can make it, and they will support them in that effort. Except, again, it takes some effort on the part of their employee to get those benefits and to accommodate them. Thank you again for letting me speak my piece.
Thank you for speaking your piece, Carolyn.
Thank you.